Hi, welcome to my podcast. So today I'm sitting here with Dr. Taran Singh, who happens to be a very good friend of mine, and we have been talking and doing a lot of work together. And I thought let's take it to the next level and show to my audience what Dr. Taran Singh, who is a maxillofacial surgeon, is doing in Dubai. Hi, doctor.
Hello Sadaji, how are you?
Good. How are you?
All good.
So, the first thing I want to talk to you is that what and who is a maxillofacial surgeon?
I would say, that is the most common question which I hear whenever I introduce myself. So, some people, mostly everybody will ask, what exactly a maxillofacial is. So, basically, so it's after dentistry, so there are total 9 branches.
Okay.
Out of that, there is one maxillofacial. In this, we specifically deals with facial structure, including jaws, the bone structure, as well as the soft tissue. In this, we have a lot of another fields as well. First goes for orthognathic surgeries, where there is a discrepancy in the jaw. So we surgically treat it and align it in the harmony. Then it goes for the trauma patients who are met with an accident, they got a skeletal fracture. So we fix that. Then it comes to the oncology, cancer related, oral cancer. So treating the cancer and doing the reconstruction. That also comes. Nowadays, there is a booming industry regarding cosmetology. So we do surgical facelift, blepharoplasties, rhinoplasties.
Right.
So anything which is related to head and neck. So either treating the disease or reconstructing it. So that comes all in total, maxillofacial surgery. We also have a minor surgical procedures such as dental implants, wisdom tooth removal, MPDS problems, so oral facial pains. So all these things come under maxillofacial.
So I was going through some Russian degrees of one of my colleagues, and he's a plastic surgeon.
Okay.
And actually, he studied maxillofacial surgery. Right, in Russia. So earlier, what I understand is that a maxillofacial surgery was a part of plastic surgery.
Right.
So how would you differentiate yourself from a plastic surgeon?
So specifically in plastic surgery, they are, as the name defines, they are reconstructing the face. But as we have a basic knowledge of dentistry, so when we close our mouth, so the bite which is we have, it is called occlusion.
Okay.
So the occlusion understanding is of course by the dentist, and we being a maxillofacial surgeon, so we have both the worlds where we are doing the occlusion as well as the facial reconstruction. So whenever we are doing any construction, so we have to take care. At the end, patient needs aesthetic as well as functional both. Everybody has to talk, chew. So for that, joint and the occlusion is utmost important.
Okay.
So that's why everybody needs a maxillofacial surgeon if there is anything reconstructing around the mouth.
So basically, I should go to a maxillofacial surgeon for dentistry or Botox fillers, or suppose, God forbid, I have a trauma, I have an injury. When is the best? Why we should choose a maxillofacial? When and why?
So immediately first point of contact will be the maxillofacial surgeon in case of trauma. And because in the general dentistry, they only teach about dentition.
Sorry, I'll cut you. What is a trauma?
Okay, trauma is like whenever you have met an injury. So trauma is an injury.
Okay.
Either it can be road traffic accident, any assault
And we are
is
talking
there.
only the face and the neck.
Face and the neck.
Okay.
So we are confined to face and the neck region.
Okay. And so first you would say is trauma. So suppose someone broke their jaw or
Yes,
their
they broke exactly. So
Yeah.
they broke their jaw, the teeth came out.
Yeah.
So that comes under trauma. And trauma also have like road traffic accident
Right.
and any assault
Yeah.
and somebody fall. So
Fine.
so all those things covers.
So I genuinely feel like if you're doing this, you're redefining the teeth, the face. So are you an artist within?
Of course, so every maxillofacial surgeon, they are good in their surgery.
Right.
But if you are talking about something when you are creating, so if you should have an eye. So if you have an eye, so you will be a little bit more, satisfying for the patient.
Yeah.
But yes, so everybody's like, for example, everybody plays football.
Right.
But being Messi or being Ronaldo, that
But
extra.
you do understand, like you must have studied. Is there any basic symmetry, like you will call this a pretty face? And
So over the social media, you must have heard about the term which is called golden proportion.
yeah,
So golden proportion is that God has defined beauty in certain proportion.
okay,
So they say, even the pyramid, Taj Mahal,
yeah,
in beautiful painting,
Right.
everything has been created in a golden proportion.
okay,
And whenever the face is very close to that golden proportion, so it appears to be, to our brain, it perceives as beautiful.
Okay.
So every surgeon who is planning to design a face, so everything goes with that golden proportion as near as possible.
but they should have that Midas touch to give the golden proportion.
Absolutely, that eye has to be there.
Yeah,
Yes,
yeah,
yes.
yeah. So that's what I feel like. Suppose today everyone wants to see before after pictures,
Right.
what the doctor has done, because there is so many of doctors who are doing Botox fillers
Right.
that I wanted to come to this question. Next question is that why would someone choose a maxillofacial doctor over an aesthetic doctor for Botox fillers?
Okay, so nowadays there is a new term which is an aesthetic doctor.
Right.
But we have to understand like what, like for example, dermatologists pursue
Yeah.
aesthetics, plastic surgeons are doing, maxillofacial surgeons are doing.
Right.
So all comes under the banner of aesthetic doctor.
Right.
Under the maxillofacial surgery, because we have been dealing with the anatomy
Okay.
thoroughly. Second, we are doing a lot of surgical work, hands-on is there,
Hmm.
where and in dentistry from the second year, like from the age of I would say 19 years.
Yeah.
So we have started handling the syringes.
Sure.
So of course, when we are doing a job from 10-15 years, it makes it as a part of. We don't have to think.
Right.
So
So you wouldn't, you have actually crossed the thing very smartly. You didn't say anything about the doctors, like aesthetic doctors and
I really appreciate because every fraternity
Yeah.
has their own role.
Right.
I specifically, when I'm performing anything on face, so I'm working very closely with the dermatologist
Right.
because they know best about the skin.
sure.
So we know, okay, we have done surgeries, we know our anatomy, and we do dental,
Right.
everything.
Right.
But so I prefer that whom is the specialist. So because the patient is not only coming for reconstruction, they also want glowing skin
Yeah.
and scarless skin.
Right.
So for that, dermatologist is the right person.
True.
So we work very closely with all the fraternities,
Yeah.
and we are working.
Yeah, you told me in fact you've done surgeries with plastic surgeons on board and
Yes.
you work with dermatologists. Doctor, another thing I was talking to you about is that I think you're also doing something called the Hollywood smile or the smile makeover.
Right.
Can you tell me more about it?
Okay, so I started this Hollywood smile
Yeah.
or Bollywood smile. Nowadays it is also called 6D, 12D.
Yeah.
So all the things are the same.
Right.
So basically now smile designing is that you have a beautiful smile in a very simple term.
Okay.
Bollywood smile, or you have a smile like celebrities.
Right.
To get that smile nowadays, the technology is so advanced
Mhm.
that you in the previous era, so you go to a dentist,
Mhm.
so they tell I need a beautiful smile or a Hollywood smile.
Sure.
They used to design everything, then they deliver it.
Mhm.
So after delivery, if you don't like it,
Mhm.
so then but it was done. So final
Right.
procedure was done. So now the technology helps us to show before and after,
Right.
even doing before the procedure.
Right.
We are now working on a concept. I specifically work on a concept that is called character smile.
Yeah.
So,
You were telling me about characters.
Yes,
And
yes.
you wrote a book on that? Or?
so I'm writing a book on a problem for the facial pain. That is
Okay.
one of the problem of the jaw joints.
Yeah.
So I'm writing a book by the name of Jaw Diaries.
Wow.
So basically, it helps in treating the orofacial pain, specifically surrounding on the.
I'll come
denture.
back to the book
Okay,
because
sure.
I think.
Yeah.
So we
So
come
that is
back
the
to
simple-
character smile.
Yes.
And is it same as smile designing or?
It is a part of smile designing,
Yeah.
but in character we are taking a next step that every person has a trait. Some
Okay.
people are introverts, some are extroverts, some
Yeah.
have a dynamic personality.
Yes.
So according to the personality, we develop a teeth design, the shape, the shade, everything, so that it works harmony with the smile. So, for example, if the person is introvert, so they have a very specific, character. According to their character, they design their clothes. They wear their clothes.
Okay.
Like the person who is very loud, they will always prefer to wear some bright colors because they have a personality, and whenever they are going for shopping, those colors only attracts to them. So you must
That's
have
interesting.
So
right.
you must have come across that many people only like black color,
Yeah.
and they have a personality which molds with that shade. So similarly, we design the teeth according to the personality of the patient.
And how do you make your customers aware of this?
So we have a form which is very elaborate regarding their to know, assess and their traits. Then after following that, then we have a conversation. So our first consultation is usually a 1 hour in which we try to understand and read the psychology of the patient, and then we plan the
So
treatment
I have
time.
figured something like that out in homeopathy, or I think they also go through the similar drill
Yes,
of
yes.
understanding the nature.
Exactly.
And they ask you get angry, you are happy.
We have other measures we do because that's how it is.
So that's fantastic. And but I've seen, like, I see a lot of people and they have done this smile designing and they look like literally mannequin, like it looks like a fake smile. So what is your thought about this?
So
Like
yes,
they're white, like
yeah.
you know, if you go in neon, you were telling me the other day that someone goes in a nightclub,
Yes.
they will just see the teeth.
Right. So basically, it depends on how much the patient is paying.
Right.
So the good quality comes with a good price.
Okay.
Secondly, it's a sometimes it's a personal choice.
Right.
The doctor doesn't have a fragility to select. So
Right.
patient says, okay, I want single color white. So then they have to deliver that because
Okay.
it's a person's body and what they want and what they like.
Right.
If a freedom is given to a doctor in regard of time and money, so then I would suggest that nobody wants to give that white smile.
Right.
Everybody wants to give something natural that nobody knows
Right.
that you have done something and it's your natural teeth.
Right. And how much a procedure like a smile design costs in Dubai? Like,
So in Dubai, so somewhere I was reading on Instagram post and everything. So some people are starting with 3,000 dirham. And
for the
then
full set?
For the full set,
Okay.
for upper and lower arch.
This polishing only or
So
complete
it's
design?
so they are putting complete design and veneering. So
Okay.
it's starting from 3,000 dirhams and it goes till even 900,000 dirhams,
Oh.
depending
900,000.
100,000,
100,000. Okay.
90 to 100,000.
Yeah.
Yes, of course, if the price is such, so lot of things will be differing.
Right.
So material, the technology they are using to design, and of course at area, clinic, everything is also
Yeah.
a matter on that.
Perfect. And what is veneers?
Okay, so veneer is a material which is fabricated in the lab,
Okay.
and it has been put it on the natural teeth. There are two kind of veneers. One you can get it from the lab. Another one which you can get it in the clinic. That those are called composite veneers. So basically, veneer comes like you need a natural smile.
Right.
So then you have to just putting something on your natural tooth.
Okay.
So
So
that is the
like
part.
this stays for the rest of the life, or it's
Depending on the material which you are taking,
okay?
some last for 5 years, 10 years.
Yeah.
There is something feldspathic that are also one kind of smile designing material that lasts for like I've seen cases from past 25 years. Patient is wearing, nothing has gone wrong.
Really?
Yeah.
And they don't get yellow and they don't get
So
stained.
eventually you have to maintain them.
Okay.
That polishing is required that once in a year.
Yeah.
So
Okay.
those are also
Fantastic. So yeah, it makes sense now that you do the smile design and then you do the facial design, right? And something interesting you were telling me about the book you wrote right now about jaw.
Yes. So over the period of time, I was seeing a lot of patients who were getting a lot of treatments done from. Sometimes patient goes to one clinic, they have changed their country, then they have to visit another clinic. So dental history and everything goes haywire. So commonly, I've started seeing a lot of patients who are having the pain in relation to your, side of the head, near the jaw, even in the neck area, shoulder area, and they have been going to chiropractors, and they are getting result, but eventually it comes back. So then I started practicing specifically. It is coming under our field only.
Okay.
So that is called MPDS, myofascial pain dysfunction syndrome. So basically in this, the facial muscles which are specifically in the movement of jaw, those are
Right.
called muscle of mastication.
Right.
So those get involved, they get tensed and stressed out, because of which the jaw activity changes.
Okay.
And because of that there are certain pain points, which we also call trigger points,
Right.
and those develop over the period of time. There are a lot of factors. So for example, the most common factor is stress now, which is part of everybody's life.
Rampant in everyone's life.
Yes. So stress is there.
Yes.
Then they have parafunctional habits. Some people have a habit of chewing pencil,
Yeah.
eating nails. So all those are over the period of time develop certain conditions.
So you treat that as well.
So I treat that as well.
Mm.
So I'm writing the book specifically for the people,
Okay.
so who can read
Mm.
and then understand, okay, if they are having those symptoms,
Mm.
so then they can immediately visit whatever, because most of the time patient doesn't know I'm having these problem,
Right.
and whom shall I visit.
Yeah.
So in that case, it's just an awareness book.
Is it a more of a neuro kind of a disorder or more muscular?
So it's more of a muscular.
Muscular.
Yes.
Because I did read there's something like EMS also and such things. So you use the same technology?
So we have multiple technologies.
Right.
First, to define the to scan the occlusion,
Right.
and our main purpose is, first we need to balance the jaw joint with the occlusion, so that whether it's in harmony or not.
Okay.
So we use a lot of technologies. We have intraoral scanners. We have specifically a bite scanner, which helps us to analyze graphically and
Okay.
digitally.
Okay.
That we have. Then we have lasers to help down to relax the muscle. Then there are other procedures. Dry needling is there,
Right.
depending on the condition of the patient.
Right. Amazing. So yeah, you can tell the name of the book, so everyone should read it.
So-
where is it available?
So currently it's on the final printing stage.
Okay.
So next month, so we'll be introducing to the world.
Okay.
So it's by the name of Jaw Diaries,
Right.
Struggle and
And it's
Strength.
for the doctors or for?
It is for majorly for the people.
Okay.
So that, and it has been made in a very fictional manner.
Right.
So that everybody don't want to hear about all the medical things.
Yeah.
So it has been formulated in such a manner that the reader will get involved and they can relate themselves.
Fantastic.
Yes.
Fantastic. So now what's the direction you're taking? You're more into reconstructive or aesthetics or dentistry?
So currently, majorly I'm working. So I have a motive.
Yeah.
So my motive is to create some functional and aesthetic rehabilitation of the people above 40 years of age.
Okay.
So because 40 years of age is the age where the degeneration starts at the faster pace, specifically in females after menopause, it starts rigorously. Those people over the period of time, because of their focus is not on their health, so I just want to provide them the best functional and the aesthetic rehabilitation what they are looking for. And if somebody is suffering from pain is not that which is physical. There is also a psychological pain also. So that they restrict themselves to move in the society, they lose their confidence. So I just want that whatever best I have knowledge, that I can take out and best and give it to the world.
Amazing. And doctor, I wanted to ask you, I have a lot of listeners who are doctors. So if suppose someone wants to pursue their maxillofacial or aesthetics, what is the procedure of how you are able to be licensed here to do this?
So if you are back home, you have done general dentistry, then you have done a specialization in a maxillofacial surgery.
Okay.
It is a 3-year program in India.
Okay, so after your dentistry,
After your dentistry,
You
you
study
do your
3 years.
3 years
Okay.
post graduation
okay,
in maxillofacial surgery.
Hmm.
Then if you want to practice in UAE, then you have to have a 3 years of country experience. After that, you can write down directly the exam, the licensing exam. Once you clear that exam, then you can practice as a
Right.
maxillofacial.
And for every thing like you're doing aesthetics and all, I think they do require regular certificates.
Yes, so regular CME points are there. You have to be certified from a university. You must have done a program there.
Right.
So all those things are
So
the general requirements.
It's been so many years of studies to bring you here today, right?
Yes, yes.
And
yes.
that's what makes the difference. Like many people want to know that what is the knowledge behind the doctor
Absolutely.
who's treating them. I've always been fascinated when I go to a clinic and I see so many certificates on the walls. And I think it's a very important part, especially I feel back in Asia and other countries, there are a lot of doctors who are working out of scope of what they are actually supposed to do. So I would love to know more about your background. You actually told me that you've done so many other studies. So where were you working before Dubai?
So I was practicing in India.
Okay.
So I came from Canada. I was 2 years in Canada. I did my healthcare administration program and I was working with the clinics. Then in 2017 October I came back to India and I started my own practice.
Okay.
Slowly and gradually it was working very well. Then I got my license in UAE.
Right.
And then I wanted to expand my practice not only in one area because I love my own surgery as well. I got an opportunity in a medical center in Sharjah and so I'm currently associated with them.
Right.
And slowly and steadily I'm increasing my bandwidth.
Yeah. Fantastic. In fact, that's been one of our reasons of meeting each other.
Absolutely.
And your licensing
Yes,
in Dubai, and so it's such a pleasure because you meet people who have come from various walks of life and how they have grown their career. And so you think you are happy moving base to Dubai?
Yes, Dubai has a lot of opportunities.
Right.
And the people are more open-minded over here and the acceptance is high.
Okay.
And so I'm enjoying Dubai.
Yeah. And what's the major difference you see now between India, Dubai, Canada?
So major difference is, which was somewhat similar in Canada, that there are a lot of ethnicities. In one area, you'll meet multiple people, multiple mindset.
Yeah.
So, like for example, if you are treating locals, so they have a different taste and different mindset.
Right.
Simultaneously, you're treating Europeans
Yes.
and then Indians. So it gives more brain work. And okay,
And
this
there's a
patient
diversity.
the diversity.
Right.
The more diversity is. So
Yeah.
it's more enjoyable.
And one thing I feel good about Dubai, being an Indian, you don't feel that you're away from home.
Absolutely.
Great. So you can tell them if someone wants to meet you and get your services, where they can contact you.
So thank you very much for having me here.
My pleasure.
And so if you have any questions regarding what we do, how we can help you, so kindly reach out to my Instagram handle by name Dr. Terry Maxfac. I would request Dr. Siddharth to mention it below the video.
I'm not a doctor.
So you are associated with a lot of doctors.
Yes.
For me, you are doctor. Because doctor doesn't define, okay, you are
I'm
treating.
a doctor in business.
Doctor in business, absolutely.
It was such a pleasure to have Dr. Taran on our podcast. Thanks for watching.